How is an abdominal hysterectomy performed for cervical cancer? How is an abdominal hysterectomy performed for cervical cancer? This surgical procedure is designed to remove the uterus through an incision in the lower abdomen. It provides the surgeon with direct access to the uterus and surrounding tissues, which is crucial for ensuring complete removal of cancerous areas. The process begins with the patient under general anesthesia, lying on their back. A urinary catheter is placed to drain the bladder during the surgery. The surgeon makes an incision, which can either be vertical, extending from just below the belly button to above the pubic bone, or horizontal, known as a bikini line incision, just above the pubic bone. The choice of incision depends on various factors, including tumor size and the need for wider access. Once the abdomen is opened, the surgeon examines the pelvic organs to assess the extent of cancer spread. The next step involves mobilizing the uterus by carefully ligating and cutting the supporting structures. This includes the round ligaments, ovarian ligaments, fallopian tubes, uterine arteries and veins, and parts of the cardinal and sacrouterine ligaments. The bladder is gently pushed down to separate it from the uterus and cervix. After freeing these structures, the surgeon clamps and cuts the connection between the cervix and vagina, removing the uterus along with the cervix. In many cases, nearby pelvic lymph nodes may also be removed for cancer staging and treatment. The vaginal cuff, which is the top of the vagina where the uterus was attached, is disinfected and sutured closed. The surgeon ensures that bleeding is controlled before closing the abdominal wall in layers. This open abdominal approach is often referred to as a radical hysterectomy when performed for cervical cancer. It allows for thorough removal of cancerous tissue and is considered the preferred surgical method for most cases. While it typically requires a longer hospital stay compared to less invasive methods, it offers better long-term cancer control. There are minimally invasive options like laparoscopic or robotic surgery, but these have been associated with higher recurrence rates in cervical cancer and are usually reserved for select early-stage cases after careful discussion with a healthcare provider. In summary, an abdominal hysterectomy for cervical cancer is a detailed surgical procedure that involves the stepwise removal of the uterus, cervix, and often lymph nodes. This is done through a lower abdominal incision to achieve the best possible outcomes in cancer treatment. Always consult with a healthcare professional for personalized medical advice and to understand the best options for individual circumstances.